Quickly, thank you very much. Well, my presentation today is on perception and individuality, and it is certainly one of the things that helped me keep very interested in the work that I do, because every single person coming to us for their treatment is obviously an individual, and they have their own perceptions of their reality. And basically, the talk today is about the role that perception and individuality play in the onset and the incubation and the evolution of complex disease and disorders. So we deal with a lot of very broad spectrum of conditions, from spinal cord injury, injured patients, right through to all the chronic fatigue, the ME, motor neurons, and so forth. But it's mainly to do with the fact that, we have some simple rules that we've been able to identify over many years that seem to be very consistent with the role that when people present to us with these conditions, one of the things that we see very clearly is that their perception of reality in terms of how we can measure perception is very far from accurate. So with my presentation today, there's a lot of slides in here that aren't of use for the presentation. They're mainly there for when I publish it on a PDF format. So I'll be skipping through a few slides as we go through. But basically, how we see the world, how you don't see the world as it is, you see the world as you are. And the main point is how we perceive our world governs how we respond to it. So we need to know something about perception when we're dealing with the individuals. How are they perceiving the world? And of course, it's been something that's been very difficult for people to try to measure, but what we did was find some very simple ways of doing that over the years. And the way the process of neurophysics therapy is to be able to take people through certain exercises where we know what the real features of the environment actually are, and to be able to measure what their person's responses are to those movements based around that knowledge, and to see where the mismatches are. Now, consequently, because it is one big communication network and we don't see things as separate sight, sound, touch, or smell, it's a flow of information for us. So that all becomes integrated, all that information becomes integrated in the association cortexes and cores. So all we are basically doing is tapping into one pathway through the somatosensory pathway to discover how the individual, for themselves even, for how they discover how they respond, taking information from the world, and how they emotionally elaborate on that information. So errors in perception are often subtle, but can accumulate with significant consequences over time. And I'll be sharing with you today, as I said, some of those techniques of how we go about that. And hoping that other practitioners can take a note of some of these and be able to utilise some of these concepts themselves when they're working with their patients. So what is neurophysics therapy for people who don't know my work? So neurophysics per se is a branch of medical physics and science, and usually they're studying perception, action and cognition at a very high grade, usually a molecular scale. So neural networks and complexity science are some of the tools utilised to make sense of the data. But basically at this molecular level, they can sort of see the things when a person is perceiving biting an apple, when they're actually biting an apple, and they can see all that, but it's very difficult to make predictions about things from there on in. Neurophysics therapy, I founded it back in the late 80s, and I'm very proud to say that it's earned its own footprint within this branch of science. And so basically it's a study of the functionality and the behaviour of the human nervous system, and how it perceives and responds, interacts with the environment, and the development of specialised techniques to optimise the system's functionality, behavioural potential to accomplish certain outcomes. I've been quite successful over the many years, and there's been a lot of international media and national media attention paid paying tribute to some of the outcomes, significant outcomes of people with complex conditions. So on the BBC and 60 Minutes and so forth, and all cumulating in Academy Award nominee Stephen Pawlowski multi-international award-winning documentary Calibrate, which is a beautiful film with people who have come from all over the world for treatment for neurophysics therapy, telling their stories. So it's quite heartwarming, and if ever you get the chance to see it, you won't be disappointed in that. So individual variability in perception. So basically gives me an opportunity here to introduce some of the techniques that we utilise. So we have two people here that presented with the same condition, an older lady at the top there and a younger woman at the bottom. So both these people are utilising the same machine, same technique and the same machine to go through what we call a grid. So the machines actually supply a very stable backdrop. The stimulus that they're using is the lightest stimulus that the exercise machine can actually afford. So it would be typically on one plate. So we know that the stimulus coming into them is mild. They are in a safe, supported environment. There's no lines running around the room, of course. They have all the controls. All they're being asked to do is to close their eyes and to move those handles across their body very slowly. The area that we're targeting there is the pectoral region, and that region there is a highly sensitive area. So we know that if something comes into that space very quickly, we'll close out and turn into a protective state. So it's stimulated, so it's very intimately connected to all the high order emotional processing regions of the brain, things that are very personal to us. That's what we've called peripersonal space. So as the person is coming across that very pathway, thinking about more of a flow of information. So it's not an arm exercise, we're thinking of their system as a whole. So it's like if a elite tennis player serves the ball, that's their whole body that hits that ball, not just their arm and shoulder. So they're giving lots of instructions in terms of that. They're thinking of where their hands are positioned in space-time relative to their feet. Their feet are splayed out, their knees are wide. If we see their knees starting to move in towards one another as they're going through this movement, it would suggest that they're moving into a protective state. So like I said, the conditions are very mild and their environment is very stable. However, as people with the pathology start to move these arms across their body nice and slowly, they are unilateral, by the way, too, which we can see what's taking place in one hemisphere compared to the other. So as they move across the body very slowly, that's when we'll see typically a lot of underlying fears and anxieties will emerge. Now, it's not the environment that's responsible for that. It's not the machine that's responsible for that. That is the person's default responses they have to the environment all the time. Their system doesn't start inventing responses simply because they're sitting on this machine. It refers to its history. So there would be associative memories, all sorts of things that would trigger such responses. And of course, it's out of sync with the true features of the environment itself. So our role then is to help that person calibrate to these type of stimuluses to have appropriate responses to the environmental stimuli again. Now, as I said, these people all have pathology, so we see that when the person's going through this and what we see those initial responses are, that is interconnected to their present state. However, if we help that person to tune that and to calibrate to those points, each point in space-time having its own particular value, then as time goes on, the person has then re-established normal networks of functionality within the landscape so they can respond to it. Now, the condition that they presented with was very sensitively dependent upon those early rogue responses. So by changing that up, it's all like altering the algorithm that's giving rise to these rogue patterns of behavior. And that means neurological things. We're talking about genetic disorder, or supposedly genetic disorders that can be corrected in very small timescales at the same, using the same techniques. So all the negative perceptions from the past that they've had, can be past trauma, false beliefs, cognitive filters, emotional states, medical gatekeeping, suggesting that once they've got a certain condition, this is what the prognosis is going to be, and there's going to be no escape from that, and institutional dominance regarding the prognosis. So they can all have an effect on a person. By the time people come to us out in Australia, most of the people come to us is from overseas. We are typically their last resort. So they've tried everything else and they've come to the realization that they are the only ones that can help to fix themselves, and we're going to be there to help them go through that. So long-term patients, these were. So in both these people, we've had very successful outcomes in very small timescales. So perception is a detrimental function. So sensory input is filtered and interpreted. And perception is not a passive act. It's not a passive perception, but an active construction. So we see our behavioural and emotional responses and motor outputs are shaped by the individual's subjective filtered reality. And this is where the conflict becomes, because the innate system knows exactly what reality is, but it becomes in conflict with the person's subjective version of that. And turbulence is the result of competing energies. So when I relate it to turbulence, which it can manifest in all sorts of things like anxiety disorders, things that can go on to become much more sinister over time. That, of course, so we have to then line that person up and help to calibrate that person appropriately back to environmental stimuli again. What I didn't mention before then was the role that the visual system plays, where we have the person with their eyes closed, because the visual system is the dominant sensory experience, as we know, but it very much is there to help us to maintain our skills, good, bad, or indifferent. So for an elite tennis player, the visual system works very well in helping the person to maintain their skills. But if a person has a depression, for example, and they're walking around with their head down and they're with posture neglect, then that becomes the visual system's reference to the world. And its job then is to help to maintain the status quo. So we need to close the eyes, allow the person to calibrate their system appropriately to that environmental state and their emotional responses to environmental stimuli, and then we get them to slowly open their eyes up and then to calibrate their visual system to the new states. So a healthy versus distorted person, a healthy nervous system generally produces accurate timely responses to environmental cues like the tennis player. Perception errors distort internal representations of reality, leading, for example, to unwarranted muscle tension. And that's what we see the background tone in people, and it has increased in society over the years. So, I've been doing this for a very long time, and 35 years ago, if a person had presented with the level of tension in their trapeze muscles and their thigh muscles and their abdominal muscles, so their system is very highly, the sympathetic nervous system is very highly activated, and it's remaining that way for very long term. So dysregulated breathing, anxiety responses, again, to non-noxious environmental stimuli. So cognitive distortions is something that is very much highlighted, and so we see a lot of those the black and white thinking. If I can't complete the program perfectly, I've failed entirely. Minimization, where yes, I slept well last night for the first time, but that's not a big deal. So there's a lot of cognitive distortions that people actually present with. We don't counsel them in any way about that. They will say certain things. We just tend to ignore that. And by simply going through the process of neurophysics therapy, clarity and groundedness emerge without direct cognitive coaching. So it's something to show that people might be harboring some false beliefs about things, and it's all contributing to their present state. And by simply going through all the grids and calibrating their system appropriately, a lot of that stuff just gets taken, it comes out in the wash. Like I said, we'll have to miss a few of these, but just the simple things like the gut feelings, the mechanosensing, where people have these sensations. They're sitting in the same room as lots of other people, but they're having a sensation that something's wrong. And that, again, is a misinterpretation of the features of the environment. So small errors, if unresolved, accumulate over time, and this accumulation distorts postural tone, as I said, like a depressed person, motor timing, emotional regulation, autonomic balance. So the motor timing comes into a person then having to navigate their environment more cautiously, and that's not to do with that background tone I was talking about. The system becomes saturated with compensations and setting the stage for disorder. Psychophysical disease or complex neurological disease emerge from not a single error, but the untethered interaction of many accumulated ones. So common motor errors arising from perception errors. So one of the things, like I said, by going through and assessing a person, how they're responding to the environment through some very simple movements. As such, one of the movements there we're using what's called a lap pull-down machine. So remember, the arms are unilateral. So as the person is performing that movement, again, with very mild stimulus, they have their eyes closed. So as they're starting to pull those handles down towards their body, most people can keep their trapeze muscles disengaged at that point. It becomes counterintuitive when they get to the bottom and they start to go back up the top. That's when they tense up in the trapeze muscles. So we can see that things are compartmentalized dependent upon where stress comes from. So it would suggest that in some parts of their life, they're very good at taking stress on, but they have a heck of a lot of trouble letting stress go. So behavior is behavior. It's scale-free. How we behave under certain conditions is going to be very much mirroring how we behave under other conditions out in our real world. It's corresponding exercise, which is where you'd be sitting up straight, pulling the handles in towards you, towards the person. This time they would tense up coming in, and they don't have any problem letting it go the other way. So you can see that there's two distinct responses, even though they're targeting the same areas in terms of that particular region of the body. From the linear way and lateral way, we can see that there's two distinct ways of dealing with the stress. So we need to be able to dispose of all those inconsistencies, so it doesn't matter which machine the person's on, whether they're applying the stress on the concentric phase or the eccentric phase, that they've learned to emotionally remain stable under all those conditions. So if I was in another room monitoring their arousal through their trapeze muscles, I should know which machine they're on, whether they're applying the stress to themselves or disposing of that stress. So this is one of the most complex people I've ever had to deal with. So Diane, all these people have given permission to use their real names, and these are testimonials that have been publicised. But Diane, she was diagnosed with corticobasal degeneration, and I've dealt with quite a few people with that in the past, but nobody has come close to presenting the way that she did. So she was in a completely frozen state. I'll show you some footage in a second. So how she is sitting on that machine there when I was trying to just get her to relax her arms enough, we had to literally carry her from that chair in that position over to that chair. That's how frozen she was. And for a healthy person to have that level of tone in their body, just even try to maintain that tone, they would not last more than 5 minutes. It was just insane. So I'll just show the bit of the footage that we had to. This is what she was like. Now, what I've discovered was that Diane had been using a whole body vibration machine for several years. So she was a triathlete. She started to have shin pains. Somebody suggested her to use a vibration. She got some relaxation of that, and then she kept using it. The pain would come back. She kept using it. Then she started to develop other types of symptoms. So she kept using the machine over a long period of time. And after a while, she could not lift her right arm. Her body was in this frozen state, but it kept maintaining the use of the vibration machine. So that was something that we definitely had to dispose of. This is how she presented. You can see how stiff her arm is, and she had this hum. This was continual. Like you see this vibratory type of hum. Took quite a bit of effort. I had to keep getting destructive interference with her, try to develop a rhythm that her body was producing to try to destructively interfere with it. As time went on, we gradually were able to loosen that up and start to get some movement into the machines. And then 4 days later, she was able to start taking some steps. So there's a link there to the whole video. Like I said, if this is published in PDF, you'll be able to click onto that link. So it's quite outstanding to see what can take place with these people. And she was able to then start to say a few words. So the role of the stable environment, so I said we need something reliable to be able to measure the person's perception with, and because as the person sitting on the machines, I've drawn a grid over the top of that particular exercise. It's one of the most common exercises we use first up because we can see very quickly how a person is emotionally responding to their environment through that particular movement. But as I said, it's having that grid where we know what the features of the art, we know what the qualities of the machines are. So the person interacting with that, the environment is stable, they have all the controls, so we can start to see the mixed matches between their responses to the environment, what the real responses should be. But of course, as I said, all their conditions that they present with, it's all nested within those initial responses. And by destabilizing that and allowing the system then to stabilize itself within these grids, they can have some reliable measurements then to go forward with into the real world. But everything is calibrated. The reason we have to have a grid, because everything is calibrated to that vertical constant of gravity. So gravity goes straight down, the ocean goes the other way. There's math and there's structure and organization in that. So everything, like I said, is calibrated to that vertical constant. So we need to have that type of structure. So the machines provide that structure. So at each point in space-time, the person can calibrate to those particular points. Basically saying the same thing there. So nervous system self-referencing network. So all we need to do is create the conditions where the system can reflect upon itself, identify what is normal and then what is not normal, and then start to correct that. So the ACG, of course, the anterior cingulate gyrus is very crucial in all this, and this is where things have gone rogue, where their perception of normality has been altered in some way. So the neurons, even coming up through the amygdala that should be reporting safety and comfort, have somehow crossed over at some stage and are reporting fear and anxiety in conditions that aren't representative of that. So again, the anterior cingulate plays a role in terms of normalizing things, making predictions about what is going to happen next. And so this is where we have to primarily get in and start to upregulate the anterior cingulate gyrus, so it's reporting more accurately to the features of the environment. So the main points, NeuroPhysics therapy exposes mixed matches between internal prediction and external input, perturbs and interrupts rogue energy inefficient patterns, and promotes formation of new stable neural network firing networks. So this person, getting onto, again, the perception of things and belief systems and so forth. Again, so we have a long-term MECF chronic fatigue sufferer here, Yolanda. So this is her testimonial. So case one, she arrived very long-term. Her initial state, hypersensitivity, fear, immobility, very much collapse prone. Within weeks, improved sleep, emotional stability, functional mobility. So we'll let Yolanda tell her story here.
Ware. I'm from the Netherlands. I'm 35 years old and I have chronic fatigue syndrome for 14 and a half years. I've tried several things, seen very much.
Can everybody hear that?
Yes, doctor.
So just had to check that story.
My name is Ware. I'm from the Netherlands. I'm 35 years old and I have chronic fatigue syndrome for 14 and a half years. I've tried several things, seen very much doctors and alternate treatments. I'm also voluntarily admitted myself in a psych ward, but all the things didn't help me. So this is kind of a last resort to gain my health back. NeuroPhysics therapy for me is it's been a wild road. It's been a bumpy road. It's been ups and downs. It's so much. It's being able to reconnect with my body again, being the observer, not dissociate from my body, which I was used to do. Because if I would like to do something, I had to dissociate from my symptoms to be able to get out of bed or get out of the house. And here it's just the prime focus is on my body. It's about what's going on, what's the emotion, what's the physical complaint, what are the sore muscles or pain, and to stop, to give it notice, but then let it go. And don't be offended by it or don't be determined by it.
Well, at the start, it's hard to see what's happening. So you see the physical movement, you see that your partner is struggling, but you don't know what's going on actually. So that's the weird thing you have to wrap your head around. It's good that you also as a partner can get some sessions so you know what it's like to do the therapy.
There are small things I notice, like I'm being able to have a conversation with my husband again, being able to listen to him and ask him questions about his feelings, not only having a monologue by myself, so some more dialogue. I'm standing or sitting during the day, which I didn't before. I laid down most of the time. There's this headspace to make myself a cup of tea or to mention things around me. So there are differences. I'm feeling stronger. I feel I'm different. My body is different, but it's still a battle between my body and my mind.
In the Netherlands, Jolanda didn't have much mornings or moments where she felt like where the burden of the lack of energy was away. So there was always this lack of energy, which was as a sort of a big weight on our shoulders. But now what we've experienced is that for a couple of moments, that has gone away. So that's a huge difference. Even though there were small moments, like maybe an hour, but that's a huge improvement, because I believe that this can build up and become 2 hours, 3 hours, and eventually might go away entirely.
The main difference for me is the combination of mental health and physical health. So there is no difference between, it's always stick together. So if you have experienced something like anxiety, it will show in your body, or if you show deep pain, it's mostly due to something that happened to you. So the unique experience over here is to learn that there is a coherence, a bit of two of that, there is coherence between mind and body, and you have to be prepared to look at your body, what's going on, and acknowledge it.
Basically, if you narrowed it all down into what that all meant, is it simply comes down that we altered Jolanda's perceptions. So what her perception was initially when she was going through those moves, where she had quite, her emotional responses to those movements was very acute. We had to stop several times to let her to recover from that, and then slowly work through it again. But it was simply about altering her perception. So case number 2, spinal cord injury. I have presented this before, of course, but this is all relative to this person. So this is getting into more beliefs and perceptions. So John McLean is a very high-profile paraplegic athlete. He's the first person to swim the English Channel as a paraplegic and to complete the grueling Hawaiian Ironman. So we're very well known. John had been wheelchair dependent for 25 years. So And he, despite his amazing athletic accomplishment, resigned himself to the fact that he would never be able to walk again, as predicted by the medical experts. So again, it was the medical experts that told John, that convinced John that he was never going to walk again, and so this was his belief that he upheld. John came to me in 2013 for pain issues. I'd never actually worked with a person with a spinal cord injury before. People with spinal cord injuries would come into my centre with physiotherapists who would take them through some movements, but basically the thought was today, well, there's not really a lot of point because nothing much is going to happen, so they're just giving them exercise for the sake of exercise. However, when John came to me and I started to sort of explore his system a little bit more and going through the grids, as we do see with Yolanda going through, just tapping into areas where he could actually move, and more, like I said, much more to do with his managing his pain and correcting his pain perception. As we start to go through that process, and we're tapping into John's underlying chaotic rhythms of his nervous system, which is another talk altogether. And it simply means by when the people are actually going slow through those movements, when it's applicable, if the person really slows them down and just relaxes, we'll start to see the beginning of a tremor emerge. Now, that's just the natural chaotic rhythms of the nervous system that are being expressed. And the more they relax, the more that increases in value, and to the stage where it can become quite dynamic. It allows us to assess the noise that's in a person's system. But in John's case, what I'm going to show you now shortly is that when he very first started to engage with this machine, so remember, John had a belief that he's never going to walk again. Now, he had no control over his legs. They would just be flopping out to the side. But as soon as John started to engage with the machine itself, this is what happened. So I was telling him to relax and just think about flow of information through his body as he was doing it. So we're seeing the iterations up the top. He's learning to relax more and more. Then all of a sudden, his legs became triggered. So this was the original footage. John likes to have everything recorded, so it was very valuable to have this. And we've seen at that time that his legs were doing in sync with what his arms were doing. Now, to me, not having worked with a spinal cord injury before, this was really fascinating because I knew the role that central pattern generators play in the terms of being able to communicate supraspinally. I did say to John at the time, John, I can't see why things aren't working better for you because everything seems to be working. And he actually got a little bit offended with that because he had assured me that he'd been around some pretty smart people in his day and that he was advised that, he was confirmed, that he was never going to walk again. So anyway, as time went on, things became a lot more obvious. So his legs became quite dynamic to the point that the other machine, the red one he was on, the cable had actually come off that. So, but you watch what happens when John disengages from that and just returns back to his normal belief pattern instead. The legs just flop straight back out the side again. So there's a complete disconnect between what his body was displaying and what John had actually access into himself. So I asked him what did he want to do, and his goal was to walk, and so we focused on doing other types of movements that, of course, I had to help get a lot of control, but eventually John learned to tap into that and then add value to those things. And as history shows, 3 days later, John took his first unassisted steps in 25 years, and that went on to become the 60-minute story, but I'll talk about that a little bit later. But this is some historic moments here of John taking those steps. Even be able to stand up like that was fascinating.
Next week.
It's quite fascinating. There's some emotional moments there. So 18 months later, John went and completed a conventional triathlon, and we see him walking across the line there, the finishing line, with his wife and Amanda and his son, Jack. So, but however, you know, when that happened, that was very well publicized around the world. But did I get any calls from people who work in spinal cord, who do research in spinal cord injury? No, unfortunately, I can say that I didn't. And the fact that when one person can actually do this, they've got to ask many questions. And we did ask the question, how many other people are sitting in chairs around the world where their system has already learned how to get around the lesion? It's just that they don't know about it. And we very soon found out that that was the case. So the medical gatekeeping, patient conditioning, and that can certainly have a lot of effect on the person and how they present. So we have to work hard at overcoming that. So when people have been having that belief they're never going to walk again, or if they have motor neuron, this is what the prognosis is going to be. It's not very good at all. So we have to be able to work very hard to help the person to dispose of that. But incredibly, so again, this is when the 60-minute story came on. And after doing lengthy interviews with 60 Minutes and explaining the process and all that I understood about the nervous system, what its potential was, what the chaotic rhythms was about, when it come down to it, they eliminated most of that and just went to the so-called experts. And Professor Yo had been working with John ever since he had his injury. He'd been in spinal cord injury for 50 years. And so rather than more and more people around the world being familiar with their potential or having the understanding that they can make changes, this is how it came out on 60 Minutes.
Over the past year, John McLean has confounded medical experts with what he's been able to do.
The degree of his recovery is beyond my wildest dreams.
And then it went on to, later on, and so that is what the problem is. So now we're talking about divine intervention as opposed to all the work that was actually done to have John working again. So that's the sort of things that the bittersweet thing that I need to have to deal with from time to time. So again, we have to challenge the narrative. We'd say if it worked, if we'd already know about it. So this is how it gets dissed. Sometimes neurophysics therapy can be viewed by some of these people as a scam, even though we've got publications in the frontiers in physiology. There's a whole heap of other corresponding boom, the publicity on the media and so forth. So this is a lady, so Karen, she was diagnosed with rapidly advancing ALS, MND, so 12 months prior. When she arrived, her right arm was completely flaccid with no ability to move her fingers again. Her fingers, within 2 days, she was using her right arm to assist her to wash her hair and able to hold a bottle of water in it. So we can say how powerful that prognosis was for Karen, and to be able to show her that that simply wasn't the case. So I'll get on to find the... Here we go. So this is Karen telling her story. So it's quite emotional at all these testimonies.
I was diagnosed with motor neuron a bit over 12 months ago now. And so when you're diagnosed with it, they tell you you've got 1 to 5 years to live. And you can look forward to, you're losing the control of your limbs, being peg fed, having trouble swallowing, like choking on your own saliva, and having gone machine. So, there is no future. So I came up here hoping for a miracle, or at least some easing of my problem. Well, after a 2-hour session with Ken, I had a future again. And a future that was just like everybody has, like I can look forward to their grandchildren growing up. And yeah, just amazing. So pleased that Ken has come into our lives. So when I came in, my right arm was dead, really. I couldn't move it, and very far, and my hand, I couldn't move my hand, had no fine motor skills at all. My breathing was laboured at times. I was all hunched up and depressed, and swallowing, like I had to have 2 pillows at night so I wouldn't choke on my saliva when I was asleep, and worrying about swallowing something that I would choke, and how, like, Tim had to learn, was shown how to help me if I was choking, and help me with my breathing, and that's just gone. That's just not there in the equation whatsoever.
Yeah, it's very surprising for the effort that Kieran's put in to do it. It's very basic movement. It's pure movement, I suppose, and you probably come in and you see a fully set up gym and you think, oh, it's about lifting weights. It's using those machines just to get the limbs, like getting full movement out of them. It's quite unbelievable to watch what they do. So, to see, the improvement in this 4 weeks, as Kieran said, you can, go home and cuddle the grandkids, whereas before, doing it one-handed wasn't the same. So, look, it's a great future for her. So, I'm just glad to be part of coming up with her and doing it. And look, they really are a great group of people.
Oh, I feel so much younger. I feel lighter. I feel like my arm now belongs to me again, and like my breathing, my swallowing, and that is just normal. It's just, it's just amazing, totally amazing. Like, you can actually live a life with this, and a good life, and just seek alternative things. And this isn't a crazy alternative thing. There's nothing. There's no drugs that go into your body. There's no heavy weights that are going to hurt you. There's no needling. It's just all pure. You get to know your body, and just go out there and don't give up, like I did, until I found Ken and Nikki and Riley.
Now we can just go back to, hopefully our normal lives, She may not get back to being 100%, but, it's a case of keeping up the movement in the limbs, and, that is going to require a little bit of work. But if she keeps doing that, I can just see the improvement, coming back to, as close to normal as possible.
I think anybody who has the opportunity to come up here and work with these people, just grab it. And it's just...
So basically it goes back to the same thing, just altering Kieran's perception and disposing of that belief, which just, as those type of things just unfold as we're going through the grids. It's that moment-to-moment operation. So yes, it can be very slow. We'll be very patient, often having to give the person some feedback along the way. But as you can see, some pretty incredible things can happen in very small timescales. So there's one Kieran that informed her that this was her condition, but underneath of that, her system was quite capable of reflecting upon itself and normalising itself again to a very large degree. So the elimination of rogue patterns of behavioural responses to non-oxygen environmental stimuli is what it's all about. So you can see that, again, she had some quite, Kieran had some quite overreactive responses to the mild stimulation as we went through. We had to lateralise her hemispheres. So the left hemisphere, which of course runs the right-hand side of the body. So we needed to do everything bilateral. So the right hemisphere could tell the left hemisphere what it needed to do to catch up. So the lateralisation of the hemispheres is able to be achieved through these particular machines because of the fact that they're unilateral, and we can help the person then to have much more centered experience of it. So this was as data. So day 1 pre NeuroPhysics therapy on the top left hand side there, and then day 1 post NeuroPhysics therapy. So this is her stance analysis. So we could see in that data alone that despite the fact that she reported feeling much better, we see in the data the big separation between the hemispheres there. On post day 1, we see that there's a much more collectiveness of that, and it did stuck then. So when we measured pre day 4 NeuroPhysics therapy, there was a lot of lamidarity there, so it actually stuck with her. And then post day 4, which is much more favourable, we see lots of interesting dynamics where there's lots of variability in there, a lot more frequency, a lot more amplitude, rather than just what we look at day 1, where there's a massive amount of frequency but very low amplitude. So we can say now the system is a much more complex system. It's displaying much more complex behaviours than what it was before. Disease, disorder, despair, or however we like to call it, is often viewed as a loss of the system's complexity. So with neurophysics therapy, the aim is then to help the system increase in complexity. So normalisation, sensory motor communication. Once perceptual errors are resolved, sensory motor integration with the true features and the ambient nature of the environment harmonically emerge. Clear, efficient signalling allows for calm, fluid movements and emotional clarity. Core outcomes, reduced anxiety, better posture maintenance, and more adaptable behaviour. So restored perception often includes sleep restoration, emotional regulation, pain reduction, digestive improvements, and system no longer trapped in high energy, low functional states, from maladaptation to multi-system coherence. Another person, this was a person with a very long-term, he's very well studied, this person in the Netherlands, because it's a very special case. How you see that photo on the top right-hand side, that's pretty much how he presented with us. Again, within 2 weeks, he was down the beach, swimming in the water and so forth. So again, a severe, unlocking of that potential through the fact of altering that perception. So he was pretty hard work. There was lots of downtime going through it, but a little bit at a time he came back. So there are lots of implications there. Like I said, there's transferable, but you can't understand the neuron in isolation of the organism that it inhabits, and you cannot understand the organism in isolation of the environment that it inhabits. So it's only by studying the organism as it's interacting with the environment, we then know what the neurons are doing. So there's some simple rules that we apply here. We cannot save the world. We can only help people who really believe that there's a better version of themselves and are prepared to do the work. And I often say that it's all the wonderful people who we've had the opportunity to work with over all these years who have created the reputation for neurophysics therapy, because they are the ones that have done the work. They are the ones that have gone through the tears and the fears and the anxieties and whatever it's taken to land in the position that they did, and they totally own their outcomes. So that is the caveat. As I said, it's not something for everybody, and that's why we have to filter really well as to who's suitable for neurophysics therapy, and they need to want to get well themselves. And nobody's going to get plugged into a machine that's going to do it for them. There's no medicine that's going to be applied. It is all about them taking ownership over their existing behaviours and then modifying them. So I'd like to thank sincerely the organiser again for hosting the virtual event and inviting me to present today. And thank you to everybody who persevered with me during the presentation. I hope that you enjoyed it, and I hope that you hopefully learned something from it as well. And my sincere thanks to the thousands of patients who've trusted in my method over the last 35 years or so, and for all the many assistants and neurophysics therapy practitioners who have helped to evolve the international reputation of neurophysics therapy to where it is today. So thank you very much.